I saw the first signs in 2006. I started having pains. I thought they were tendinitis, so I went to visit physiotherapists and tried many things to soothe those pains. But as they wouldn't go away, I then went to see a sports doctor who advised me to have some x-rays done. It's at this very moment we discovered a start of arthrosis. The pains were likely to be acute tendinitis in the groin area, but they didn't prevent me from moving. Pains would rise and constantly wake me up at night, so I couldn't sleep anymore. Then things got worse. Sitting would also hurt, and I started being less flexible to such an extent that I could no longer walk.
A hip implant is often required in all cases of hip joint deterioration. These circumstances can be traumatic as they're related to diseases or intensive sporting activities. A hip implant is often necessary when one has an intensive sporting activity associated with joint malformations. In practice, people of all ages may require hip implants. They can be in their 40s or older, but even younger in some cases.
I went to see a GP and told him straight away the purpose of my visit and asked him to do some x-rays. He clearly responded in a rude way, that he wasn't a magician. But I had to give up all my activities and change jobs. But with hip arthrosis, everything was over. After I left his surgery, I didn't feel great. It's at this moment I realized I had to go and see a specialist to at least discuss it.
The first consultation is essential. First, it's the confirmation of the diagnostic, to phase out diagnostic errors or troubles that are not originally related to the hip. And then we define with the patient his expectations and objectives in order to consider with him the most adapted treatment. If the treatment requires an implant, we are compelled to discuss this matter in depth to know which technique to use according to the type of implant required and what to expect afterwards. The patient's demands are constantly part of the conversation and play a central part in the setting of the surgical targets.
I managed to get an appointment with the hip surgeon, but I wasn't thinking of an operation. Far from it. I just wanted to discuss it. According to the x-rays, the arthrosis was well advanced, both on the right and left sides. The surgeon told me about an operation involving a customized implant. He said, "Why keep suffering? According to the x-rays, I know you're in pain and that you're used to it." It's true that my couple and job suffered from those pains. I wasn't well. I was unhappy. The situation had to change and the implant would save me 10 years. So I said to myself, yes, he's right.
If someone intends to have a customized implant, then more developed examinations are required than for a standard implant. Standard implants are programmed on two-dimensional X-rays. Custom implants need a CT scan to allow the three-dimensional reconstruction of the hip. This reconstruction will be of actual size. It's absolutely essential that choosing to opt for an implant must follow complete psychological maturation. It would be a very damaging and harsh situation for the patient if he endured any pressure from the medical profession or surgeon to choose a radical intervention such as a joint replacement. If 2 or 3 consultations are required, we need to take time to reassure the patient on his current situation and tell him that he is not an isolated case, that many people live with an implant. Also, the patient needs to be reassured on his later ability to carry on with his life, activities, sport and work.
I was supposed to have both my hips operated, one after the other, as it's written in the protocol, but the thing was I was part of a company. I'd have to end my contracts. With that kind of job, you can't afford to have such a long leave and wait that long. And it's not in my character to act like that either. Consequently, I kindly asked him if he could operate both my hips at the same time.